I'm going to ask each of the CEOs to comment very briefly on the impact of COVID-19 on their organization's fundraising and sustainability. We're all very aware of the devastating impact on the sector, and I want to give each of the CEOs just a brief opportunity to outline for themselves how it's impacted on their own organisation. So could I turn to you, Ava, first?
Okay, so MS Ireland receives approximately 50% of our funding from the state, and our remaining funds come from fundraising, donations and legacies. However, since the last major crisis which we faced in 2008, and since then we've been hit with a range of funding cuts, and these have not been restored, and they've undermined us, I suppose, and our bottom line. Then if you add to that the 1% cut that we have received in 2020, and this is all before you even think about the catastrophic impact that we have now had with COVID. So in relation to COVID, we've experienced a 37% drop in our fundraised income up to September of this year, which will be around €1.2 million.
Okay, thank you, Ava. Could I move on to Peter then to give that brief excerpt?
Thanks, Mags. So at Epilepsy Ireland, our typical budget is around 1.8 million a year, of which we need to raise about 800,000 for fundraising. That is used to supplement HSE and other state grants for support services and for our training, our advocacy, our awareness raising, and our research funding. I suppose most of our fundraising at Epilepsy Ireland is community and volunteer driven, and I suppose because of COVID, that's been particularly badly affected. Our latest projections are that this year we'll only be able to raise about in around 400,000 euros, which is about half of what we need for the year. So we have been trying to protect our frontline services and support, and we've had to make some very difficult decisions, like postponing our plans to fund new epilepsy research this year. But even after all those measures, we're still looking at a very significant deficit for the year.
Okay, thank you, Peter. And just finally moving on to Pat Little from the Migraine Association.
Well, we're a much smaller charity in terms of our income. It's around 250,000 a year, and about 60% of that would be state funding. We are the only organisation supporting people with migraine and headache, of whom there are over 500,000 people. And stress is one of the biggest contributory factors to migraine. And obviously, when the COVID thing kicked in, a whole range of things kicked off in terms of services being wiped out, basically because people didn't have access to migraine clinics, even to GPs. All those kinds of things went instantly. And so there was a big surge in stress levels and a big increase in migraine. So we were left for the last number of months as being the only organisation supporting people with migraine. Our funding, the rest of our funding comes from different sources, but face-to-face events help us bring in, a certain amount of fundraised funding that helps us balance the books.